Good evening. Welcome to another episode of Urban Renal Talk with Tamika and Steve. I am half your host, Steve. Thanks for joining us. Before we get started with the show, I'd just like for y'all to send prayers to my partner, Tamika, as she is under the weather tonight. She's doing well, but she's so forth under the weather that she couldn't do this broadcast. So please keep her in your prayers. Tonight we got a great show tonight. And if you're a dialysis patient, dialysis warrior, or you're in stage 4, stage 5, and you're about to make that transition and they're talking about access placement, we got the guy that's going to give you the 411 on this. Um, this doctor, very, very down to earth surgeon. Uh, I met many vascular surgeons. This gentleman is really, really nice gentleman. We got Dr. Tej Singh. He is CEO, founder of Fist Assist Devices. He's a vascular and an endovascular surgeon. He's also an entrepreneur. He graduated from the University of Chicago, where he did his undergrad in med school. Then he headed out to Stanford to do a surgical training. I mean, this guy, young as he is, he done did many, many fistulas. He done went to Japan. He done worked on cats, animals. I mean, this guy just was creating fistulas, and now he devoted his life to make sure warriors who have undeveloped fistulas or who has these challenges with their fistulas, when it's created, he created a device that can actually help you. So without further ado, let me bring this gentleman on. I'm glad to know him. I'm glad he reached out to me. I'm blessed to know him. Without further ado, Dr. Tej Singh. Hey, Dr. Singh, how you doing?
Steve, so great to be on. It's a special night. You guys do a great job, and it's great for me and an honor for me to be on talking about something which I'm really passionate about, which is fistulas.
Absolutely, absolutely. So, just share a little bit about your background and what brought you to the point where you're at now in your life.
Yeah, so Steve, thanks again to all the viewers out there. I hope this is an informational event for you. I hope you learn a lot tonight. So, I really grew up, originally, I was born in India. I grew up in Chicago. My parents came to Chicago when I was 2 years old. I grew up in the west side of Chicago, went to a great high school out there. And then I went to University of Chicago for my undergraduate degree, med school degree, and then eventually out to California. But really, the best time for my life happened around the second year of my undergrad, where I had the opportunity to work with some great vascular surgeons as a college student. They trusted me to start doing animal fistulas to study the arteries and how the arteries adapted. And with that research, I launched my fistula career. And with that research, I launched some ideas about the device, which we're going to talk about tonight.
Mm-hmm. Mm-hmm. Wow. So, to get right into it, can you explain exactly what the fifth assist device is and how it's used?
So, Steve, when we were doing those animal surgeries, I noticed that the fistulas on these rabbits and animals, we unfortunately didn't use a lot of cats back then, Steve, but we did a lot of.
Right.
Um, I knew that if you opened and closed a fistula with the high flow, that the vein would get larger. And so I took notes on that. My research department really didn't spend a lot of time on veins, but when I became a surgeon after training at Stanford, when I started my practice, I really realized that if we could give the fistula some type of exercise. Now, there are different types of exercise. You could do a squeezy ball, you could put a rubber band, you could put a tourniquet. But what I noticed on my own patients when I became a vascular surgeon, that the vein is everything. A successful fistula needs not only a good artery, it needs a good vein. To get a good vein, you got to be conditioning that vein. And the best way to condition that vein, do weights, do a lot of hand exercises, do a lot of gardening, play a lot of basketball, whatever you can to get your muscles and your veins bigger. So with that, I started a lot of research, a lot of understanding, And I made a device which I'm showing here today.
Okay, let me put you solo. Okay. So that's a device, the
This
fist assist.
wear it on your arm below the elbow or above the elbow. This is the Fist Assist device. It's basically a 1 inch by 3 inch box that has got a Velcro attachment. You wear this, line it up with your thumb. You wear it on your arm. It goes up to a pressure of 60 millimeters of mercury. This vein will compress your superficial compartment where your cephalic vein lives. It'll go up for 60 millimeters of mercury, hold for 20 seconds, then deflate. It does not act like a tourniquet. It is not going to compress your arteries. It should not hurt anything except just put light pressure on your vein. With that, based on my research, based on my understanding of the basic science of veins, the clinical science of veins, and what we know our athletes have always taught us about their veins, we put all those sciences into one device. We have a full patent. We have a full company. Fist Assist Devices is now in testing for eventual sales in America at some point in the near future for vein enhancement, vein dilation, and vein conditioning.
Wow. So that brings me to a question, because during my career, and when we have new warriors that start dialysis and they just got their access placed and the surgeon said we could cannulate it, we have technicians and nurses that use tourniquets, and some of them may put the tourniquet on too tight, leave it on, may go do something, come back. Some may not put it on tight enough. Now, with that being said, because you don't know what you're going to get when you got a person putting the tourniquet on at their pressure, with the fist assist, that eliminates that problem, correct?
Well, Fist Assist has a lot of roles in the warrior world. And I love that term, the warrior, because all the patients who are listening to this, you all are warriors. You're all my patients. One way or another, I've taken care of you in spirit or physically. And I have a great vascular access patient population here in Northern California. Fist Assist has got many roles. And let's go through those, Steve. We can use Fist Assist 3 months before your surgery to condition your veins, and the University of Chicago is doing that trial right now. Then, after you've had a successful fistula surgery and hopefully Fist Assist has made your vein ready, you can then wear Fist Assist for the next couple months after your surgery to get that vein ready. And that was a trial we actually did in India, which showed that you wear our device after your fistula surgery, your fistula is going to get bigger. And once again, while shear stress, while tensile stress, nitric oxide changes are what lead to the vein dilating. Now, here's the point that you brought in. Once a patient has worn this before surgery, worn it after surgery, now he's going to go for dialysis. When he or she goes to dialysis, instead of asking the dialysis technician to put that tourniquet on or to wrap something silastic around the fistula, the patient can put on their Fist Assist. And the most important fact tonight, Steve, the highest pressure, wall tensile pressure in your fistula is 40 millimeters of mercury. You don't need a tourniquet. You don't need a rubber band. You need something that can compress that fistula, and that's 60 millimeters of mercury, and that's what the Fist Assist does. Now, you bring that in, you put it on, it goes up for 20 seconds, it's going to hold, you put your needles in, you take off the Fist Assist. And now here's the last piece of the puzzle. You go home after your dialysis, you're recuperating, you take your bandages off, your fistula looks good. Whenever you're ready in the next day, 6 hours, 8 hours, put the Fist Assist back on. Continue that stimulation, continue that exercise, continue giving your fistula opening and closing to keep it from handling clot, to keep it from closing on you, to continue the process of exercise and maturation of your fistula. It is the most important thing to decrease the cost that we're facing in this country, to decrease the amount of ballooning and stenting people are doing. Now, a lot of these things have to be proven by trials, but if you believe in basic science and clinical science, and you believe in my 30 years in this space, there's been no device like this. It truly is a groundbreaker.
It definitely sounds like one. Now, for individuals who may have diabetes and this is looming in their future, the possibility of dialysis, or they've been approached, they may be asking, because diabetes damaged the veins over a long period of time, is this something that could help them as well?
Yeah, so that's a great question, and once again reflects your knowledge and expertise in this space and this arena, Steve. This is a device. When we talk about diabetes and hypertension, those affect the artery primarily. You need a good artery to make a fistula. So you want to control your blood pressure. You want to control your diabetes. And it's an important education phase that when you get diagnosed with chronic kidney disease, stage 2 or stage 3, that you control your risk factors. And I think everybody, Hispanics, African Americans, Caucasians in this country and in this world, need to make sure that when they get that diagnosis, control it. Now, veins usually don't get affected by diabetes and high blood pressure. Veins get affected by IVs, by PICC lines, central catheters. So as long as you can control your diabetes and high blood pressure, you'll keep your artery healthy. A healthy artery with a healthy vein makes a beautiful fistula. Fist assist is going to do nothing for your artery. Fist assist is going to help you get that vein ready. And we would recommend probably at stage 4, where you're probably 3 to 5 months from a fistula, just because of the natural progression. Remember, every year 150,000 Americans start dialysis in this country. Many of them live at stage 4. Now, if we can do a good job and keep people healthy at stage 4, we don't need dialysis. But eventually, 150,000 Americans are going to start dialysis in 2019. I would love for all of them to have gotten their veins ready. How do you get your veins ready? Play basketball, go gardening, do weights, do whatever you can in your home. But if you can't do those things, or you want something more, that's where our device comes in. We don't want to replace exercise. We want to do some exercise for you.
Mm-hmm. Let me ask you this. What would you say to those people that can't process getting that in their arm because they're still trying to process of having the disease? How could we, I guess, convince those individuals that this may be a part of your life? And how do we change their mindsets as individuals? Because I've seen a lot of patients who had catheters for years because they were really adamant about not getting surgery. So how do we change those mindsets, being that you talked about how catheters and PICC lines affect the veins?
Right. You're talking about a topic which is coming up more and more in the dialysis space, and that is fear and hope. These two words are crucial for a stage 3, stage 4 kidney patient. They have fear. It is natural to have fear of dialysis. It is natural to have fear of a catheter. It's natural to have fear that you may lose your life. Many of these patients have family members, but there is hope. There is hope in education. There's hope in prayer. And there's hope that we think a device that patients will look at as they stimulate their arms, as they get their veins ready. It is truly known that a good vein and a good artery leads to successful fistula placement, only one-time fistula placement, and the way the world is going, home hemodialysis is going to be available rapidly in this country. Medicare has asked that more and more patients do home hemodialysis, and let me tell you, when you have a good vein, a good fistula, a supportive family, there's hope, there's less fear, and if you got a good fistula, that is your access to excellent dialysis, home dialysis, and eventually a kidney transplant if that comes your way.
Absolutely. I agree with you 100%, Dr. Singh. You definitely make sense, man. I wish, if I ever come on dialysis, I would hope you be my surgeon. But let me ask you this. With that being said, why more of vein dilation is not being promoted? Well, let me take that question back. What causes a patient to get multiple access surgeries? I've seen patients that had 2, 3, 4 failed fistulas and grafts. What is that common reason for those multiple accesses and failures?
Yeah, and that is the real crux of dialysis and hemodialysis. And you, once again, Steve, are showing your understanding in this arena. And it is truly a process that the government has put money into with new initiatives. I think there's many factors. The patients need to come earlier. They don't want these. We don't want our patients to have catheters in their necks, folks. A catheter in your neck is a great way to dialyze, but that catheter is going to either cause an infection, you're going to get admitted, that catheter is going to cause a stenosis or narrowing of your vein. These are not good things to have. So, what is the issue? The issue, once again, becomes education. Patients, when they get stage 3, stage 4, need to make sure their veins are ready. A good artery. At the end of the day, I hate to say it, you need a good surgeon. You need a surgeon who's passionate about vascular access, who can look at your arm and say, maybe we can do it here. Maybe we can do it up here. This is what your vein looks like. Maybe I'll get you. I have all my patients exercising their veins. I can't give them my device yet because it's not ready, but I have them exercising. I want my patients to go in with the best vein, the best artery, the best education. And yes, some of my fistulas do need a balloon. Some of my fistulas do need surgery to have a second time. But you want to go to a vascular access specialist. You want to go to a doctor who does a lot of this, who has an interest in it, who's not just going to make you the last case at the end of the day because he likes his nephrologist. The patient needs a good surgeon. The patient needs to be educated. The patient needs to have less fear. And the patient needs to have a good understanding that it's an artery and a vein, and whoever connects those two, that's important.
Now, let me ask you, if a patient may say, why do I need to go to the access center multiple times for cleaning? Is that necessary? Because we've seen, I guess, since I want to say maybe late 90s, early 2000, and it could be early, it could be more of the booming of the access centers, which are, as you know, independent access centers that work on vascular access, doing catheter exchanges, fistulograms, and other small procedures for access. Is it necessary for a patient with an AV fistula that's having a great run, that's having good numbers, meaning, say, venous pressure at, say, 400 blood flow rate at 150 megahertz, and arterial pressure may be running at negative, say, 140, 160. The point is it necessary for a person to go 2 to 3 times in a year to get their access cleaned out, as they call it?
Yeah, well, that's, once again, you bring up a good topic here, and it's a very controversial topic. Obviously, access centers, we have to assume the doctors who are partnering with those access centers are ethical, they're honest, they're working for the best interest of the patient. At the end of the day, it's the patient, it's the warrior that we want to take care of. You're a nephrologist, your dialysis center. As long as you've got a team supporting you, educating you, and helping you make those decisions, I'm assuming that all physicians, all healthcare providers are going to do what's best for our patients. Now, having said that, there's been many cases of access centers, some of the stuff you're probably alluding to in an indirect way of maybe doing too many procedures. I don't want to speak about that. I'm not a
Sure.
That. But what I want to say is the patients need to be educated. Your loved ones need to be educated. You need to have a very good nephrologist. You should contact your technicians. Your technicians are wonderful people who understand your access better than anybody. You should understand your access. You should give your access the best health so that you don't need other procedures. And if the data says you need a procedure, then have it done by somebody you're comfortable with, who explains to you all the risks, benefits, and complications. Make sure you're comfortable and make sure you understand what's going to happen. But if you just think things are happening for a reason, ask for another set of eyes to look at your fistula. But at the end of the day, we're hoping to front load this so that patients know a lot more about their fistulas and a lot more about their veins. And hopefully a simple external device can get that going for us.
Absolutely. And see, just like Dr. Singh said, if you're not happy with the care that you're getting, there's always the option of getting a second opinion. That's why they have a second opinion. not everyone knows, everything. So, hey, Dr. Singh, when did the idea come into your mind to invent a device like the fist assist? I mean, was it an aha moment when you were doing surgery, or were you out, maybe playing golf or doing something and the idea came up? How did you come up with that vision?
Yeah, so Steve, once again, a college kid, I was basically doing the fistulas. I was seeing what's happening, kept a little notebook on the side. Nobody wanted to listen to me. I was just a skinny little college kid.
Wow.
Then I go on to becoming a vascular surgeon. Now these patients are my patients. I'm doing the fistulas. I'm no longer the student. I'm no longer the resident. These are my patients. They're entrusting me to make these fistulas work. And that's when I went to all the tricks. I said, what about squeezy balls? What about rubber bands? And like all entrepreneurs, there's a time for it. Now, I was married. I had 3 little boys. They were all active boys. I had to be with them. But when my kids got into little later in school, in middle school, high school, I looked in the mirror. I said, you know what? I think I have an idea. And then the natural thing an entrepreneur does is you protect your idea. You go and see if you can get a patent. And lucky we were able to get a patent on a device that basically said if we compress a fistula or we compress a vein to make that vein bigger on the arm with a balloon, and we're a pneumatic compression balloon. I want to emphasize that we're not shocks, we're not electrical current, we're a balloon. We're just an inflation balloon like a blood pressure cuff. We got that patent, and when we got that, Steve, then you start the entrepreneurial path of getting money, making a device, making a prototype. So really, I think it started in high school. Sorry, it started in college. Went away, through my residency. I went to Japan for 2 years. I did a lot of fistulas there. More studies. Spoke to the Japanese researchers about it. So it really was a 30-year process.
Wow.
Excited that while we're ready to launch now in India and eventually in Europe, great team. I've got a great team around me of great supporters and great colleagues and advisors. We're ready, and it takes a long path, but there's a timing to do that. And it's a long journey, but I really believe that this journey is going to have a great result when all these patients across the world have this device.
Absolutely. Absolutely. So when coming up with that device, did you have any of your colleagues in your world, the vascular surgeon world, kind of laugh at you or kind of, dismiss this device?
So, when you're an entrepreneur and you're out there launching something, you go out and you speak. And I would tell you that all my investors said, if anybody gives you a hard time that this is snake oil, this is not going to work, we're pulling out. So I was waiting for somebody to say, this is stupid, this is not going to work, blah, blah, blah. It never happened. And here's the most common question that me and my team get. The most common question from technicians, nurses, and doctors is, why didn't I think of that? So there was your aha moment. We gave everybody the aha moment because they all felt, and even the founder of Fistula First, that doctor came up to me and in a very angry voice said, I can't believe you invented the device I should have invented. So people who know fistulas know that exercise, external compression, narrowing and opening the fistula with some intermittent compression is all good. The basic science, clinical science says it works, and that's really where we were at.
Mm-hmm. Mm-hmm. Now, how would this device help patients who have problems with their fistulas now? Could this help someone who already have a fistula, or or it's just designed for new fistula placements?
It's going to help everybody. It's going to help stage 4 patients who need a fistula. It's going to be worn a week after your surgery. It's going to be worn when you bring it to the dialysis center. It's going to be worn when you go home from the dialysis center and the next day you want to exercise your fistula. I think this device truly gives patients an opportunity to partner with something on their arm, which will educate them, give them hope, decrease their fear, and become their partner in their fistula journey. We want to be a partner with every patient's fistula. Now, I'm going to cut to a very important fact.
Sure.
We're never going to stop every fistula from failing in America or the world. But let me tell you this. If 20% of Americans get a better fistula experience with this device, just 20%, we will save this government and Medicare $512 million a year. So
is that how much is being spent on fistulas
well,
or surgery?
we are spending billions of dollars on
Mm,
taking care of fistulas. $2.3 billion to take care of the fistula. The surgeons are getting paid about $40 million to make the fistulas. But look how much money we're spending to take care of those things. That includes the catheters. That includes the different interventions we've talked about, ballooning, stenting. All those things come into a significant risk and cost. So cost savings is the future. Medicare can't be spending an useless amount of money on fistula maturation, fistula dilation. The FDA understands that. Medicare understands that. Your community will understand that. And we got to do things differently. And let's do things differently with new devices.
oh, absolutely. Why do you think that for a lot of new warriors who get access and they get instructed by the discharge nurse on what to do, the exercises to maintain the patency of the access and to build it up? Why do you think some warriors fail to continue that process or just don't do it at all?
Well, compliance, right? If we took care of our medications, if we took care of our exercise recommendations, if we controlled our diet, a lot of us would be very healthier. And that goes from the physicians all the way to some of the most ill patients in our hospitals in America today. Compliance, compliance, compliance. You've got to follow the recommendations of exercise, arm exercises, squeezing the ball. But the bottom line is that no matter how much we educate, there's always going to be patients that just don't do it.
Right.
I think people
Right.
do it and they have other priorities and they think that medicines will take care of their problems. So what we're hoping with Fist Assist is that we're hoping our patients will say, you know what, I'm not going to exercise my arm tonight, but you know what, I'm putting on Fist Assist and I'm going to exercise my fistula, and hoping my fistula will do a good run in a couple of days later. And so we want to bring the exercise to the patient. We would hope nobody buys Fist Assist. We would hope everybody buys a rubber ball, a squeezy ball, a rubber band, and goes to the gym. I don't care if Fist Assist is replaced by exercise. But
Mm-hmm.
the reality is, what you said, Steve, is that patients need Fist Assist.
Right, right, absolutely. And I saw someone ask the question, is this device available now? Greg Griffin. And Greg, no, it's not available now in the US, but it is available in India if you happen to travel over there. Um, so I know you said you was kind of short for time. How much more time do you have, Dr. Singh? I know you're busy.
Yeah, about 11 minutes. I do want to answer Greg's question. That thank you for the interest. We are in the process of doing the last safety trial for the University of Chicago to show that the veins do get large on stage 4. The FDA has asked for that submission. The FDA is very aware of this device. Remember, the FDA is responsible for the ultimate safety and allowance of any device in this country. We totally want to respect the FDA. We totally want to do what's right for the patients. But we think the device is battery operated. It's probably not going to shock anybody. It's probably a safe device. But we want to do everything right for our government and to ensure all the warriors and Americans in this country who buy Fist Assist feel they have a good, safe device. So
Sure. Wow. Okay. Hey, Dr. Singh, I had another question for you. Courtney Brown, she wants to know what happens when the graft stop working. How is it fixed?
So remember, I want to make sure that everybody understands the terminology. There's a fistula and there's a graft. A fistula is your artery and your vein. They don't tend to clot off that much unless the vein doesn't get big. When you get a graft, that means your vein wasn't good enough, or the surgeon wanted to put in a Gore-Tex graft, a bovine carotid artery graft. There are different names for these: PTFE, Gore-Tex, bovine carotid. Grafts get infected. Grafts don't last as long as a fistula. Grafts, when they get clotted, you either have to have a surgical procedure to open them up, or you need to have an endovascular procedure where they can put in medication called TPA, which breaks up the clot and gets that graft open.
Clot buster. Mm-hmm.
Every warrior could get a fistula. The cost of fistulas to take care of them is so much less than a graft. Fistulas will last longer than a graft. This really is the way to go. We at Fist Assist Devices want to help our Americans and the people across the world get a vein that can be a good surgery site. So that's our mission.
I had another comment from Miss Kathy. She just stated that I am stage 5, but my kidneys have settled, and I am okay now. She has a fistula just in case. So, I mean, it looks like, you have people who are taking heed, and someone like Miss Kathy, who said she's at stage 5, but her kidneys have settled and she has her fistula. This would be a perfect time for her to use the Fist Assist, because while she's just selling, waiting around, really, she needs to be doing the exercises right now. Right, Dr. Singh?
Miss Kathy, this is a great time for you. Your kidneys have settled. We hope, with all our prayers, that fistula continues to work and that your kidneys hold steady. But you need to be ready. You have been blessed with a beautiful fistula. You need to be exercising that fistula. You need to either do weights, 20 minutes a day.
And they could be small weights, right?
Yeah, 10 pounds. 10 pounds up and down like this. Okay? The other thing is really important is that you take your other hand and squeeze that fistula a couple times during the day. Have your loved ones, have your family do that. Extra open and close that fistula. You're not going to hurt it. You're going to give it exercise. You are conditioning that fistula for a couple things. One is it's going to get bigger, it's going to last longer, and when those needles, and I hope they never get placed, but if those needles get placed into that fistula, that's going to be a good, durable fistula for you, Miss Kathy, and that's really important.
And speaking of needles, Dr. Singh, is it still recommended or suggested when first using a new fistula to start off with the lowest needle and then work your way up?
Yes, a lot of theories on that. I think small needle cannulation. There's a lot of experts. There's cannulation videos. I'm going to name a gentleman who's joined our Fist Assist team. He's a cannulation expert of the world, Stuart Mott, M-O-T-T. Look for his information on some of the websites, Home Hemodialysis, lifeoptions.org, all these medical education institute videos and websites out there. Learn about cannulation. Become educated about your fistulas. It's going to help you in the long term.
What for Miss Kathy asks, what if they say I can't carry more than a certain amount of pounds? Is there a conflict of interest when you say if they have get the weight and then the surgeon tells them don't lift more than a certain pound, but you're saying under the recommended, under what they suggest, like 10 pounds, they don't want you to lift 20, right?
No. So remember, we're talking about a couple things. Before surgery, you can lift all you want. The first week after your surgery, which I'm sure Miss Kathy has already passed, you probably want to be careful. You got some fresh surgery sites, you got some sutures, you got some skin surgery. And then after about a week, start out with 5 pounds. And after about a month or 2 weeks, you can go up to 10, 15 pounds. You're not going to hurt your fistula. And I want to say something really important. And I think we should talk about this in the future. Remember, we're talking about a surgeon placing fistula. In the future, there's going to be new endo-AV fistulas that your patients are going to have. These are catheter-based fistulas, which are not surgically done. They are done with catheters. They are done with heat. They are done with radiofrequency ablation. We can bring a fistula and an artery and a vein together below your elbow using the radial vein, radial artery, ulnar vein. These are new types of fistulas. And so they're, at some point, Steve, we probably are going to have to do a session on that.
Oh, absolutely, man. Absolutely. I would love it. I would love it. One more question. I know you got to go. What would you say to the warriors who experience nerve damage? What's the common cause of nerve damage when someone gets stuck by a needle and the person that's doing the cannulation, what has actually happened that caused the nerve damage with the needles?
So most of the time, that nerve damage is going to be in the upper arm. And it's because near your brachial artery and near your cephalic vein, there are sensory nerves, but there is also some upper arm nerves. And if you hit the back wall of that fistula and you get a bruise, you get a hematoma, or you hit the nerve with the needle, that's nerve. It's never really permanent. It can be treated with a lot of physical therapy and exercise. Sometimes the surgeons will move a nerve out of the way to get the fistula sewn in. I've had that on a couple patients. Ultimately,
Uh-huh.
ultimately, it's a pain problem. It's never really a motor problem. It's a pain problem, and you just need heat, some Motrin, and some time to let that nerve settle down.
So let me ask you this: could someone, if that's a permanent problem, could they actually get that like blocked off or frozen where they won't feel that nerve? Would that be any like permanent damage?
It won't be permanent, but you probably don't want to do that because those nerves are really important for hand function, arm function.
Got you.
You don't want to take the hand away.
Got you. So it's going to take some time for that nerve damage to kind of repair itself.
Got it. You got it.
Great. Oh man, Dr. Singh, you didn't gave out some great information. We would love to have you back every so often, like as a guest speaker to share what's going on in the vascular world. Your device, Fist Assist, I know when it gets to the US will help a lot of patients, especially African Americans, not just African Americans, but many people who have problems with their veins before they may need to get a fistula surgery done. In a device such as Fist Assist, I feel has added value to this market. And I can't wait till it comes to the US.
Well, Steve, I appreciate your time and your willingness to educate the community. You've got a wonderful presence. Your knowledge is fabulous. Your understanding of the renal space is fabulous. I know our paths will cross again. Your patients are benefiting from your Kidney Alliance and what you're doing. We at Fist Assist are proud to support you, proud
Thank you.
to decrease the fear and to give hope. And I think that's a term that everybody on this video feed will appreciate. We at Fist Assist just want to give patients another option to help them with their veins, help them with the education, and you giving us this forum tonight is fabulous. So I really appreciate your time.
Oh, absolutely. Anytime you want to come back on and share some updated information on the Fist Assist or any other new technology that you may be bringing out that's going to be beneficial to kidney warriors, please let us know, man. We love to have you on. Like I said, I wish you was here in Baltimore because I'll be sending a lot of patients, who get diagnosed and need to get that surgery. I would definitely recommend them to you. Well, and anybody out in California, if you got kidney disease and you headed that way, see Dr. Tej Singh. This guy's awesome.
Thank you very much, and blessings to all your viewers out there. Thank you very much.
All right, Dr. Singh, I'll be in touch. Thanks for coming on Urban Renal Talk with Tamika and Steve.
Thank you very much.
All right, man. Take care.
Bye-bye.
Right. Man, this was a great show. I mean, this is what we're trying to do, get professionals and people who are honestly sincere and giving information and letting you know what's going on. How many surgeons? Now, I'm sure there's a lot of surgeons across the U.S. that are sincere, but here in Baltimore, I don't know how many surgeons I could have got that would have appeared on the show. Even though Dr. Singh was on here talking about his device, he was honestly sincere and gave information that was valuable to the renal community. And a lot of surgeons and doctors, they got this air about themselves that they're too good to do something like this. I'm telling you, this guy, I feel, is genuinely sincere, honest in what he does. And if you're out in California and you need any type of fistula surgery or anything, go see him. He's dedicated his entire life in creating fistulas, not just in human beings, but in animals as well. So that shows you this guy is dedicated to his work. So again, thank you for joining the show. We look forward to having many more guests to help educate the renal dialysis community and the kidney disease community as a whole. I ask you again for prayers for my partner, Tamika Moore, who is under the weather tonight and couldn't be on. She's doing well. We just ask you for your thoughts, your energy, your positive vibration, and prayers for her and Urban Kidney Alliance as well. Until tomorrow, tomorrow on the Kidney Disease Education Moment, we're going to be talking about peritoneal dialysis. And my co-host is going to be none other than Don P. Mormon, the CKD New York State champions. She's going to be with me tomorrow night, and we're going to talk about peritoneal dialysis, unwrap it. If you're thinking about doing it, if you know someone doing it, or if you wanted to ask some questions about it, tomorrow will be the night. So tune in 8 p.m. Eastern Standard Time right here on the Urban Health Outreach Media. Again, thank you for tuning in tonight. Have a good evening. Until tomorrow, take care. Peace and blessings.